Okay, so the next lecture. Hello, good afternoon. Please don't sleep. Tea is served behind. But the next lecture is much more interesting than tea, right? Yes. So we have Dr. Leroy Rebello, who's going to talk with us. And I'm happy that he's talking last, so there is no time limit for him. Let him keep talking. Dr. Leroy Rebello. Huh? I am really short of words to introduce him. He's a dermatologist. He's a research scientist. He has his own manufacturing unit for herbal medications, US FDA, organic herbal certified medication. Nanocurcumin, he's an inventor, has invented many different applications, of curcumin and others. So I think that should be good enough. And for me, he's just, Leroy, please start. Give me some idea about it. So one point. Yes, and he has a botanical garden where you can actually see snakes. No. Actually see belladonna tree. You can actually see ashwagandha tree. You can actually see the real plants which give you such beautiful. I think it is. I was fascinated. It's in Hyderabad. Where I think next time you should take a video of your garden and show. Okay. So over to you, Dr. Leroy.
Thank you, Dr. Millie, for such a nice introduction. And thank you, each and every one of you, for allowing me to speak at this esteemed forum. And I know it has been 3 days of learning all about different conditions and different methodologies, different methods of treatment, and especially ozone, and how we've taken ozone. Ozone has come a long way. I've known Millie since about 12 years now or 13 years, and every time I come here, I meet so many new people, and I learn so many new things about this wonderful modality called ozone. And since today is the last day, last lecture, or I call it the last day, last show, so, and tomorrow is Monday. You know, when is the most dangerous day for your patients? Monday after a long weekend of conference. Because everyone goes back thinking that they've learned something new and want to try it on their patients. See, whatever we show here are our best cases. Nobody shows the worst cases and the cases where they fail. So every case is not going to be like this, whatever you learn. So it's important, whatever you learn, as I say, it's important to absorb, as one of the doctors said. Absorb something is important. Assimilate the knowledge and then practice it on your patient. And then come with, new knowledge or new experiences next year. Because it's not knowledge what is important in medicine. Every one of us has knowledge. All of us have gone to medical school. All of us have passed medical exams. What is the knowledge? What makes you from a good doctor to a great doctor? It's the wisdom. The wisdom where to use that knowledge. Where to use ozone, where not to use ozone. And in medicine, it's more important to know where not to use a particular modality than where to use a modality. Because the most important thing is that you should not harm. Thou shalt not harm. So don't harm your patients. Don't harm the people. I don't call them patients. I call them like my friends, my people, who come, they place their life in your hands. They trust you. You don't trust anyone with your life. You don't trust anyone with your money. Forget life. You can get your money back. But if I ask you for each of you to give me 10 lakh rupees, very few of you will trust me and give it to me. and your patients are coming and trusting you with your life. So, trusting with your life is much more important. So don't break someone's trust. That's very important when, you go back to your medical practice. So I'm not going to show you, I have more than 100 slides I prepared on enzymes and how melatonin works and all these things, but I'll just tell you some experiences. Now, it's important to know experiences what I have, because these experiences are for me. They're unique to me. Your experiences will be unique to you. And you will also develop certain experiences that you can, oh, thank you, I was looking for this. How do you change the slide? Green. Okay, so you can see, I have so many slides on thermodynamics and how enzymes work. And it's nothing great because all these slides are available on internet. I've not invented this knowledge. This is all there in all textbooks. So what I want to tell you is how to use this in your day-to-day practice. So as we talk about enzymes, you see, enzyme is something that speeds up the reaction. Okay? Now, what is the most common enzymes that you have or you use in your medical practice? I'm going to talk more of practical so that you can go home tomorrow and you can start using it. It's important that you go, when you go home from here, tomorrow, on Monday, Tuesday, Wednesday, whenever you go back home and start your practice, you say, oh, I learned this new thing which is added value to my practice. Telling you about some cycles and enzymes is not going to add value to your practice. How are you going to use it? That's going to add value to your practice. I can tell you about fungal diastase and this is and that is. But if it's not going to add value to your practice, it's of no use to you. What we're going to discuss here, I would like to make a discussion. So you see an enzyme is basically these green things. They speed up a chemical reaction, and then they remain the same as what they went into the chemical reaction. Now, these enzymes are present all over our body. They are present all over. The most simple enzyme which is present is in your saliva, salivary amylase. That is why you need to chew your food more. When you start eating, the digestion first begins in the mouth. Salivary amylase is only one of the small enzymes present in our body. There are also enzymes present in the saliva of many other creatures on this planet. Like if you see, today, there are some anti-diabetic medicines prepared from the saliva of some monitor lizards, because those enzymes help break down sugar and all. And coming back to diabetes, because most of us practice diabetes. How many people see a lot of diabetic patients in their practice? Yeah, so what is diabetes? Diabetes is not high sugar. Please erase that definition. Diabetes is not high sugar. And you can write down this new definition. Diabetes is a metabolic disorder. Okay? Diabetes is a metabolic disorder characterized by endothelial dysfunction, in which blood sugar is the only manipulable, or is one of the only manipulable risk factors. You can write this, put today's date down. 5 years, 6 years down the line, this will be the definition of diabetes. This is what actually diabetes is. Unless you treat the metabolic disorders, you'll be able to treat diabetes. Now, cancer and diabetes always go hand in hand. I wouldn't call that word diabetes. I would say blood sugar, because cancer is also a metabolic disorder. Cancer is a metabolic disorder. And every cancer drug is basically anti-diabetic drug. And every anti-diabetic drug can also be used as an anti-cancer drug. Am I right or am I wrong? You guys know it. So it's how you metabolize sugar that is important.